broadcasting right here on ABC 10. Okay, so the old expression, just like riding a bike, it is often used to describe something that comes second nature and should be easy to do. But what if riding a bike can help find answers for doctors and the children that they care for? Here to tell us is UC Davis, and fill us in. We have UC Davis Children's Hospital pediatric cardiologist, that is. We have Yanni Dayan. Welcome, Yanni. Great to have you here on the show. And, fill us in on this. You have a cardiopulmonary exercise test for children. So fill us in on this. What exactly is this testing?
So cardiopulmonary exercise testing is a diagnostic test we do in children and young adults where it measures exercise performance, exercise capacity, and actually can tell us if their exercise is limited by their heart mechanics, by their lung mechanics, by their muscles. And it's been really instrumental in several different patient populations with kids and young adults who have exercise-induced symptoms like fatigue, chest pain, dizziness, fainting, abnormal heart rhythms. We can try to sort of induce those symptoms and figure out what's going on and why and help treat them. And then another patient population we have is kids with congenital heart disease or born with structural heart defects. And the question is always if and when they need another intervention, another surgery, medication changes. So this test has been really instrumental in sort of the diagnostic process of when we need to do something else for these kids.
Okay, so very evident how this is helping children, especially when it comes to possibly there being issues that maybe haven't been fully diagnosed yet, right? Exactly, and just giving us another parameter. You know, historically, we've sort of asked our patients in clinics, how's your exercise tolerance? And it's been shown in study after study that that's not very accurate. It's very subjective. These kids are often limited externally by, coaches, parents, doctors even. And so this is a nice objective test to say, oh, your exercise capacity is X and your heart and lungs are doing this kind of thing. And then we do serial testing over the course of years and seeing how things change. And that really helps us determine, if they need different medicines or interventions. An incredibly important test that we're seeing right here, just a couple of examples of how this would work. And when it comes to this test, though, are there other hospitals that offer this?
Not in the Sacramento area.
Okay.
UC Davis Children's Hospital is a tertiary referral center for basically the whole Central Valley. So we get referrals from as far south as Bakersfield, as far east as Western Nevada, and then all the way up to the Oregon border. Wow. So.
Okay, so you service a very large mass of people when it comes to this very specific test. And incredibly important, like we were talking, this type of diagnostics is clearly kind of rare, but can be very telling. So incredibly important, especially when we have children that we really hope to have a very bright and active future as well, right?
Yes.
Okay, and so where can our viewers go for more information?
You can go to our website, children.ucdavis.edu or pediatricheart.ucdavis.edu.
Wonderful. Dr. Dan, thank you so much.
You're welcome.
Really
Thanks for having me.
Okay, everyone, make sure you stick around. We have a lot more to come right here on SacCo right after the break.
Thank you.
Yeah, so is there a certain age?
This segment paid for by UC Davis Children's Hospital.
SacCo